And you're still doing some nursing as well
I
currently?
am, yes. Yep. I've stepped back quite a bit from that. I actually went part-time after we had our third, so I was just working like 3 days a week. And then once the business took off and kind of started going down this road, I just do a day to a day and a half a week now. I actually
Go ahead.
I do diabetic education with that, so I spent about 12 years in surgery,
Hmm.
and then when I made that switch to go into less time, I also made the switch to diabetic education. So I feel like that has paired really well with the things that I've learned in my continuing ed with nursing and diabetics has paired really well with the fitness world and the nutrition, all that good stuff. So it's been kind of fun.
Yeah, for sure. How has that made you a better nurse, and maybe vice versa? How has your nursing affected maybe your views at like nutrition or personal training? Like how have they influenced each other?
Yeah, for sure. I am like I think every week I constantly am meeting with diabetics and I'm pulling ideas from how to make better choices and how to stick with it from things that I am saying and learning in the fitness world. And vice versa, when somebody from class comes to me and is asking for like different nutrition tips and stuff like that, I feel like I have a good background in being able to give those tips and just knowing the metabolism and the blood sugar and that type of information
Yeah.
being brought over to this world.
Yeah, for sure. I don't know a ton about type 1, but just also being in the nutrition and fitness world have learned a lot more about type 2, just how more
Yes.
prevalent it is. And I'm sure has you have like a steady increase in like clientele or like people you're working with throughout the years as those rates have risen?
Yes, yes, for sure. And it's interesting. I don't really like combine those worlds as far as like my patients don't necessarily come here. I mean, you have to kind of keep that a little bit separate. But I've had members at Next Level that have talked to me and said, I went and I had my yearly exam done. My blood sugar was high, my cholesterol was high, like these things and are going on. And I decided it was time to take care of my body and myself a little bit more. And then it's absolutely amazing to see them come back 6 months later or a year later, and then they share those results with me. And so,
Hmm.
like, obviously, I understand those results a little bit more from my nursing side, but to hear like how much that fitness and adding exercise into their routine has naturally, without medication, brought those numbers
Yeah.
back into range. So that's super rewarding.
Yeah, I've seen so many stories of people being like stuck with it for years and then like how quickly reversible it is just by doing those simple things like exercise and nutrition. Like within months, just seeing a lot of those
It
symptoms
is.
reverse. It really is like magic pill, and people, we look for easier solutions a lot, but
Exactly.
really just when you get that exercise nutrition nailed down and you're consistent with it for months, I mean, yeah, it's crazy what kind of payoff that can have. So
Yeah.
that's pretty cool to see firsthand.
Yeah, and I think that's probably the most challenging part is exactly what you said there is it's not the easy choice. Like it's a lot easier to just take a pill each day.
Yeah.
But long term it's the better choice and yeah, it's really cool to see that.
Yeah, it's the old thing of choose your hard. Like it's hard to live that way, live with a disease like that, but and it's hard to get up and work out and eat well every day. And it's just which one is has a more rewarding lifestyle and payoff. And so I
Yes.
think just
Yes,
yeah,
you
when you
nailed it.
frame it that way, it makes that decision not necessarily easier, but a little bit more sustainable when you have that why for sure.
Yep.